Hello. We have discussed breast cancer in detail, and I promised you that we will be discussing hereditary breast cancer in a separate sitting. So I wanted to discuss this hereditary breast cancer separately for the main reason that whenever we diagnose a cancer, people generally have this notion that the cancer is hereditary. Cancer is invariably genetic, but it's not hereditary. In breast cancer particularly, if we see 100 patients of breast cancer, 90 to 95 are sporadic. They are not hereditary. All have a genetic event and they would have developed breast cancer because of various risk factors, but 90 to 95% of them are sporadic. Only 5 to 10% are hereditary. So all genetic events are not hereditary. If it is passed on from one generation to another generation, then only it becomes hereditary. So in breast cancer, predominantly it is sporadic and not hereditary. And when do we suspect hereditary breast cancer? So if we have a patient who is young and has breast cancer and has a strong family history of breast cancer, if sisters had breast cancer or mother had breast cancer or 2-3 members in the family had breast cancer, then there could be a suspicion of whether it is hereditary. So if the mother and sister had breast cancer and she also develops breast cancer, then there is a strong possibility that it could be hereditary. So there are some pointers which will tell us whether it could be hereditary. Like if 2 members in the family have breast cancer, or if the same individual has bilateral breast cancer, or if the same individual has breast and ovarian cancer, or if 2 individuals in the family have ovarian cancer, or if there is a male breast cancer in the family. So these all constitute a high risk profile for that it could be hereditary breast cancer. So if that profile or if these features are there, we do have testing called BRCA gene testing, that is BRCA 1 and 2 testing, which has to be done for the index patient. That's a test which is done in the blood sample, and if that test is positive, then only the other siblings or children have to be tested for the same mutation what the patient has. If the patient doesn't harbor that mutation or if it is not detected, then it again may not be hereditary. So this is how we suspect whether it could be hereditary, and these are the tests which are available if it is hereditary. And if the hereditary breast cancer screening comes positive, the mutation comes positive for the people at risk, then we should employ rigorous screening methods to detect breast cancer in early stages, where we employ MRI and mammogram alternatingly every 6 months. And also we advocate sometimes surgical measures like removal of the ovaries after the completion of family to reduce the risk of breast and ovarian cancer, and sometimes even total mastectomies of both the sides is advocated if very high risk individual is there and if the patient is willing for that. So we have medical measures, screening measures and surgical measures if there is a breast cancer which is hereditary, and if we do detect such mutations. So it is not very common. It's only 5 to 10% of breast cancer patients, and it should be properly worked up after a thorough genetic counseling. And even after genetic counseling, people may opt out of the testing for breast cancer and they should be kept under screening every year. So this is in brief about hereditary breast cancers. Thank you.